Hello, everyone. My name is Abigail Lettrell, and my topic this week was related to chapters 12 and 13, which discuss treatments for physical abuse, neglect, and sexual abuse. I found an article that I thought was really interesting pertaining to treatments for child abuse survivors. The article is called Evaluating Animal Assisted Therapy and Group Treatments for Child Sex Abuse. So the article begins by briefing some facts about child sex abuse or child sexual abuse. So CSA affects as many as 1 in 3 girls and 1 in 7 boys. Nearly half of all the sexually abused children meet the diagnostic criteria for PTSD, and many more show PTSD symptoms. So throughout the study, the therapy method chosen is group therapy. The authors mention that group therapy is a frequently chosen method of intervention because children can receive feedback and support from other children that have been through similar experiences as them, which in turn helps them build trust that they have lost from maybe a family member sexually abusing them. So, let's see, therapy sessions consist of 8 to 16 weeks. The study evaluates and compares the effectiveness of 3 different types of group therapy on trauma symptoms, including anxiety, depression, anger, PTSD, dissociation, and sexual concern. So, really, though, the main focus of the article looks at how to integrate animal assisted therapy, or AAT, as well as the use of therapeutic stories into group therapy sessions for children. So, animal assisted therapy is the incorporation of trained therapy animals into therapeutic interventions. So AAT is a goal-directed intervention in which an animal meets specific criteria and becomes an integral part of a child's therapy sessions or therapy treatments. And the animal should be used to enhance the therapy process rather than become a distraction from their therapy goals. They want the animal to aid rather than to take away. AAT is used to create a safe environment that helps a child build trust and acceptance. So it has been concluded that patients who participate in AAT with their standard treatment were more attentive, open, and alert when their therapy dogs were present. The dogs created an environment that made them feel more secure, loved. They added warmth and empathy. The environment also allowed the children to feel love and support, which in turn helped them open up and talk about their abuse. And it was really cool because some of the results showed that the children would open up to the animals at the beginning, so that would help them open up to their therapist by the end of the sessions. Therapeutic stories are used to assist children to express themselves with difficult topics. The stories are created to be familiar to the child and their experiences. So with the use of an animal in the therapeutic stories, the children are able to express their feelings by projecting them on to the animal. The study compares 3 therapy groups. The first group would be just traditional therapy with no therapy animals or therapeutic stories. Group 2 would have the use of a therapy animal but no therapeutic stories. And group 3 would have both a therapy animal and therapeutic stories. So 2 of the groups incorporate AAT while 1 does not. Within the study, there were 153 children who participated, ages 7 to 17. All of the children had confirmed sexual abuse cases. They currently lived with a protected parent or caregiver. They did complete all the therapy sessions, and they were required to complete a pre- and post-test that just looked at their trauma symptoms. Each group contained on average 6 to 10 children, although the groups of boys were generally smaller due to less male clients. So the majority of the participants were female, they were Hispanic, had a frequency of abuse 1 to 2 times, the duration of abuse anywhere from 0 to 6 months, and it was most common for the abuser to be an adult. So if you want to see more of the demographics in detail, I encourage you to look at Table 1. So now, just to explain the groups a little bit. So for group number 1, which had no dogs and no stories, it consisted of 12 sessions. The therapy sessions included topics and activities related to common struggles for survivors of a sexual abuse, which could include trust, self-esteem, secrets, triggers, boundaries, self-esteem, or feelings, and more. So group 2 consisted of the same format, but it did have dogs, but no therapeutic stories. So therapy dogs and their handlers would come in and allow the child to spend 30 minutes with the dog before therapy, as well as have the dog in group therapy for the first 10 to 15 minutes. And they use the therapy animal to do an introductory activity, and then the animal and their handler left for the remainder of the session. And then group 3, which was both the use of a therapy animal and a therapeutic story, followed the same therapy format, just with the addition of the therapeutic stories. And the therapeutic stories are really cool. I encourage you to just check them out. I was not familiar with them, so it was just really neat for me to learn about these. So the therapeutic stories were developed specifically for each session topic. So the book's main character was the therapy animal, and the animal talked about, the specific topic, and it explained in detail, and it just helped create a connection between the therapy animal and the child, which helped them open up and realize, that there are other animals or people that experience the same things as them. The results of the study were outstanding. Each group showed a decrease in scores from the pre to post test in the areas of concern. Group 3, which was both the use of therapeutic stories and therapy animals, had the biggest decrease in all the concerning areas. Figure 1 on page, I believe it's 675, shows a bar graph that explains a significant reduction from the pre to post test across all 3 groups. I would just really encourage you to check that out. It was astounding to me. But anyway, there are many small details I was not able to add in this brief summary, so I definitely recommend you look this article over. It is kind of a long read, but it's an easy read, and it was really interesting. So I will post this article as well as my questions down below. Thank you very much for watching, and I can't wait to chat about my article with you this week.